A few thoughts about the Snore Less Now system mouth guard to help reduce snoring. This is for me, well, it's for my wife, for me, because I snore. So a couple things, putting it together and setting up is really easy. You want to make sure that you don't leave the um, frames or basically the mold in the water too long to boil. That can ruin it, and then you'll have problems. So you want to do it for about 3 minutes and boil those. You want to do your teeth separate. So you want to do your top and then you want to do your bottom. And the nice thing is they have these little fit guards that kind of, so this is my mold. So they have these fit guards, and the idea is that it's going to, and it's not the idea because it actually works, is it's bringing your jaw forward at night when you sleep and opening your airwaves, and so you don't have the snoring. And they do have different sizes. So if you have like an overbite or a common bite or an underbite, there's different ones that would either pull the top forward or the back forward. Let me just show you the image. It looks like this. And I have mine, I'm a 4, which you don't know what that is right now because you probably haven't purchased this yet, you're looking at it. Anyway, when you lock these two together, basically you can see that I have this, and so I'm actually trying to pull the top over a little bit. So setting it up, and you just snap these on right here. I tried to wash this off, so it's covered in water, it's not spit. And then you have this basically mouth guard template that you can just push on the bottom, and then you just bite down when the mold is really soft. Couple questions that a lot of people ask about it, how easy is it to set up. It literally took me like 10 minutes tops because you have to get the water warm to do the molds, and then you want to make sure that you kind of grind your teeth a little bit once you have it in there so that they are going to fit perfectly. As far as how to clean it, it's something where you know, obviously you want to wash off with soap and water. You could use a toothbrush. That's what I do, is just brush my teeth, but brush this so it's clean, and then wash it off with water. You do want to make sure that it dries completely. If you want to do a long-term cleaning, you would want to use something that's safe. You don't want to use like bleach or ammonia or mouthwash containing alcohol or anything like that. Additional tips is you want to brush your teeth after using the device. So if you're using this every night, which I am, you want to brush your teeth, but you should be doing that anyway. You want to make sure that you, you know, if you sleep on your side, that you want to try and maintain that position. I'm actually a roller. I roll from one side to the other. I've had really, really good sleep. But one of the things that you can do, and this is what I did first starting out as recommended by Snore Less Now, is wear it for a couple of hours before going to sleep just to get used to it. Because if you've never worn one of these before, it does take a few nights to get used to. It's just there's that kind of gag reflex that most of us have. Anyway, so the suggestion is that it may take a couple days or nights to get used to it. But the sizing is really good, and my wife has said that it's worked really, really well. Obviously, I'm not awake. I didn't record myself sleeping or anything like that. Some of the stuff I've already used, so to show you what comes in the box, it doesn't, so there's instructions. It comes with this kind of like nightly retainer box that you can put in, and then you just slide it in, and then I'm not going to be able to talk when I put it in. But again, you'll notice the design right here. This is meant to pull this forward or back depending on what kind of bite that you have. And then you also have this, which basically when you put this on the mold, you just put this in so you can pull it out and the mold is solid. So highly recommend them. Thanks so much for watching.